myocarditis, which is inflammation of the heart muscles. On May the 25th, approximately 3 days after vaccination, a 16-year-old male who was noted to have been previously healthy had received his second dose of the COVID vaccine, and in addition to fever and chills, he had symptoms which suggested mild myocarditis, inflammation of the heart tissue, as well as possible pericarditis. So both the muscle tissue and the surrounding tissue were supposed to have been inflamed. On May the 16th, 3 days after the vaccination, a 25-year-old male presented with chest pain, and the findings were consistent with myocarditis, which is inflammation of the heart muscle. On May the 26th, a month and 2 days after the vaccination, an 86-year-old male was diagnosed with pericarditis and atrial fibrillation, and they had presented with chest pain. Pericarditis is the inflammation of tissues surrounding the heart. On April the 1st, approximately 2 weeks after the March 14th vaccination, a 37-year-old female had the Janssen vaccine, and they had shortness of breath, myocarditis, which is inflammation of the heart tissue, and symptoms of heart failure. On May the 24th, a 16-year-old male, 1 day after receiving the vaccine, previously been healthy, he was transferred to this hospital with chest pain and other indicators of myocarditis, inflammation of the heart tissue. 2 days after the second dose of the vaccination, the symptoms had begun, and there was no past medical history to support the diagnosis. On May the 9th, 4 days after vaccination, a 33-year-old female was diagnosed with, after having had an infectious disease consult, in fact, about 10 days after the vaccination, 4 days after the vaccination, she had developed sore throat, sinus congestion. This looks to be quite a complicated picture, and they had suspected viral illness and viral myocarditis, which is inflammation of the heart muscle. So it's unclear whether this was related to an infectious disease, but it certainly did happen at the time of the vaccination, and the symptoms warranted what looks like a very serious hospital admission for cardiac care. On May the 25th, approximately 6 days after vaccination, a 29-year-old male was diagnosed with myopericarditis. Again, inflammation of the heart muscle and heart tissue. On May the 4th, a 27-year-old male received the vaccination, and around 2 weeks later, on May the 22nd, this person presented with chest pains and probable myocarditis, which is inflammation of the heart muscle, was the supposed discharge diagnosis, and suspected viral myocarditis. On May the 5th, 2 days after the second dose of the Pfizer vaccine, which had been administered 2 days earlier, on May 3rd, this 41-year-old male felt tired and was diagnosed with myocarditis in hospital, inflammation of the heart muscle. On May the 3rd, approximately 1 month after the April 1st vaccine, a 20-year-old male presented with shortness of breath, myocarditis, inflammation of the heart muscle. On April the 27th, 1 day after the vaccination, Pfizer-BioNTech, 46-year-old male. Reading through this, they did not receive any other vaccine within 4 weeks prior to the vaccination, and they had chest pain, went to the hospital 1 day after the vaccination, and they were hospitalized. The event required an emergency room or urgent care visit. So they certainly indicate that there was chest pain, and also, in addition to myocardial infarction, there was inflammation of the heart muscle. This person had tested negative for COVID. Here it's a 75-year-old male who received the vaccine on April the 19th, just short of 2 months later. On April the 10th, we have this lengthy report. They had chest pain, shortness of breath, they had inflammation of the tissue surrounding the heart. The chest pain ended on April 12th, but there was a relapse. On April 18th, a 21-year-old male, having received the vaccine on April 1st, this person experienced myocarditis, which is inflammation of the heart muscle, which led to